Regarding patient number 2, here we have a 19-year-old married female with a 2-month-old baby who is here for her 4th visit. Her husband is present today, and the patient presents dressed more provocatively than she's dressed in prior visits. I also noticed that her makeup is heavier than usual. Her baby is also in attendance and is in a carrier sleeping. The patient's speech is rapid, loud, and tangential, and she makes several loose associations between a video series she appears to be watching and her baby. From her ramblings, it appears that she believes her baby is an alien and she needs to, quote unquote, leave it on the mountain for the aliens to come and retrieve. She reveals plans to go camping with the baby and her husband this weekend. The patient denies suicidal and homicidal ideations when asked. The patient's husband reports that the patient has been acting, quote unquote, different for the past couple of weeks, and he is scared to leave her alone with their child. At that point, the patient interjects that she knows the secret to world peace, and giving their baby back to the aliens will accomplish it. In considering this patient's presentation, there are a few concerns. It is apparent that the patient is in active psychosis. The patient is displaying irrational thoughts and behaviors with manic episodes. Because the patient delivered a baby 2 months ago, concerns for postpartum psychosis are reasonable. Therefore, I would interview both the patient and her husband to determine how her present circumstances may be contributing to her psychosis. A comprehensive physical exam, a psychiatric review, and any familial history of mental illness would be appropriate to help determine any medical or psychiatric causative factors for this patient's symptoms. Therefore, the initial goals of treatment would include the treatment and stabilization of acute psychosis. Her delusions and disconnection from reality are concerning for postpartum psychosis. Postpartum psychosis, or PPP, is a reversible but severe mental health issue that is found in patients who have recently given birth. Although the condition is rare, it is serious and a mental health emergency. Patients who suffer from PPP are predisposed to self-harm or harming their children. Symptoms can manifest up to 6 weeks after giving birth. According to her husband, the patient began displaying symptoms 2 weeks before this visit. It is reasonable, therefore, to consider PPP as a diagnosis. Symptoms of PPP include hallucinations, delusions, mania, and disorganized thinking or behavior. This patient's presentation correlates with these symptoms. Approximately 1/3 of patients diagnosed with PPP have a previously diagnosed mental health disorder. This fact alone justifies a complete psychiatric and family history. Further, PPP is more common with patients who have just given birth to their first child. Therefore, I would ask if the couple have any other children. Often, with pregnancy, parents experience disturbed sleep patterns. This may also be a contributing factor and should be considered. Diagnostic tests for PPP would include blood and urine tests and imaging scans to rule out any neurological causes for this patient's symptoms. Because PPP is a mental health emergency, this patient may need to be hospitalized for her safety and the safety of her child. This may involve the initiation of a 5150 involuntary hold. Potential treatments include electroconvulsive therapy, or ECT, mood stabilizers, and antipsychotic medications. Through accurate diagnosis and appropriate treatments, this patient's prognosis is good, and it's quite possible for her to resume her normal activities after treatment.